Hi, I'm Dr. Jackie, and I want to welcome you to your 3-week anti-inflammatory plan. It's my belief that people suffer unnecessarily with health conditions such as joint pain, muscle pain, gas, bloating, heartburn, reflux, acne, psoriasis, eczema, headaches, migraines, insomnia, hormonal imbalances. There's a whole collection of symptoms that can be rooted in unrecognized or undiagnosed food sensitivities. Now, there's a difference between a food sensitivity and a food allergy. This 3-week program is designed to help you determine whether or not you may have a food sensitivity. So if you have a food allergy, you generally know it because you eat the food and your throat swells closed, or your lips may swell up, or you may break out into hives or develop a skin reaction or require an EpiPen. That's a classic food allergy. And most people by this stage of their life generally know if they have a food allergy. A food sensitivity is different in the sense that it activates a different part of the immune system. It's activating a delayed hypersensitivity response that's mediated by an IgG antibody. And oftentimes you'll be eating the foods maybe on a regular or semi-regular basis and feel fine when you eat the food. You might not notice any gut distress. You may not have any gas or bloating or heartburn or reflux. And oftentimes patients will say to me, you know what, I feel fine. I can eat anything and I feel fine. But they may be experiencing skin conditions or headaches or joint pain or an overall sense of achiness or migraines or hormonal imbalances. The symptoms run the gamut. And they may not understand that what they're dealing with is a state of chronic inflammation. So that is why this plan is called an anti-inflammatory plan, because we want to get to the root cause. We want to understand what might be contributing to those chronic health issues that might be interfering with your ability to lead a happy, healthy, energetic life. You might just not be at the top of your game, or you might be walking around with some brain fog, or feeling like you lack motivation and wondering, like, why can't I just get to those projects that I want to get to? So it's not until you give your body a little bit of a break from some of the foods that you commonly eat that you may actually get a glimpse of the fact that you might actually be able to feel better. Okay, so how this program works is that there is a template which maps out the foods to eat and the foods to avoid. And those foods to eat are further broken out into into green and yellow foods. So the green foods you can eat without any concern. The yellow foods you're going to want to eat in moderation, because those foods are higher in carbohydrates. So even though they may not be a common food sensitivity, they're higher in carbohydrates, and we want to eliminate or significantly decrease the amount of carbohydrates we're eating when we're trying to get to the bottom of why we might be inflamed. So those foods are considered yellow foods, and you're going to ideally only eat those foods no more than once a day, and ideally only a couple of times a week. And then we have the foods to avoid, and of course those are the red foods, and those are foods that fall in the gluten category, the dairy, the corn, the soy. So those are the categories that tend to be common food sensitivities for people. There is a symptom tracker, so that after the 3 weeks is completed, you are likely going to want to reintroduce some foods to see, how do I feel when I'm not eating these foods compared to how I feel when I do start to eat these foods again. And you introduce the foods one at a time, and you keep track of your symptoms as you're introducing them. There are some informational videos that I've included in this plan, because over the years I have distilled down some of my strategies that work both personally and have worked in my family, but strategies that I've coached many other people to implement into their daily practice, partly because I work with a lot of busy people, and I'm sure you're one of them, that maybe doesn't have a lot of time or interest to spend a lot of your energy and your time shopping and prepping food. So really what I've provided you with are some at-home strategies that maybe will help streamline this eating process for you, because I want this to be simple and as stress-free as possible. I always tell my patients, you know what, taking care of yourself and eating healthy and practicing self-care, it never gets any easier. The thing is, you just get better at it. So I welcome you to this process, and it may feel like it's not easy, but I hope that as you walk through this journey, that you start to understand that as you simplify and streamline and continue to implement these changes over a longer period of time, that you will just get better at it. So enjoy the process of helping to dial in your nutrition, to tune into your body a little bit more effectively, and get to the root of why you may be experiencing some health challenges. So again, just to recap, there is a plan, there is a description and an explanation of how to work through the plan, and there's some recipes and some videos just to help make your life a little bit easier. So enjoy.